Hello, I'm David Harrigan, Director of Labor Relations with United Nurses of Alberta. This is our second video on the joint workforce regularization process. I'd encourage you to take a look at the other video first. It provides a more overall view of what this process is, the purpose of it, and the goals. This video, we're going to talk more about the preliminary data and from a local committee level, what that preliminary data means and how it's to be used. So by now, all of our locals will have received by email from UNA documents that we call preliminary data. If you're a smaller local or a rural local, you're going to receive a one-page document. If you're a larger local, you're going to receive a document that's anywhere from 10 to maybe 40 pages or more of preliminary data. And the key thing to keep in mind is it's only a starting point. Okay? It's to be used to assist the locals in determining which areas are they going to prioritize. During this regularization process, we're asking the locals to look at every unit and every program in their local to sit down and determine whether their hours can be converted. You're going to have to sit down with each unit manager and each ward rep, unit by unit, program by program, to determine if the hours can be converted. And this preliminary data is going to assist you in determining the order that you look at those, okay? The ones that have a lot of hours that can be converted, it makes sense to look at those first and make those priorities, okay? To be honest, it may not be, the preliminary data may not be as important to the smaller locals. If you've only got one unit or one program or two or three, you may not need to spend a lot of time prioritizing which ones you're going to look at first. But certainly for a medium-sized and larger locals, it's going to be important to use that preliminary data. A couple of things about the preliminary data is that it's not perfect. Okay, you have to remember Alberta Health Services is still a reasonably new organization. They have different systems. They had to pull information from different areas, so it may not be spot on. Additionally, there may have been some errors in taking that and breaking it down by locals. So you might get the information and discover that, gee, this unit here actually isn't in our local, it's in some other local. Or you might look and say, hey, one of the programs that we operate isn't listed in the preliminary data. If either of those are the case, make sure to contact UNA provincial office. So the first thing that the local committees do then is to look at the preliminary data, make sure that all of their units, all of their programs are covered. Okay. The preliminary data looks like this, as I said, a big spreadsheet, lots of columns, lots of numbers. Okay. On the far left-hand side, it's got the units. Now, they're not actually broken down by units. They're broken down by functional center, which is a term that, as nurses, we're not really used to, but it's a budgeting term that the employers use for their accounting purposes. What we've tried to do, for the most part, is break down the functional center so that it coincides with what we know as units. Or programs. That's not always going to be the case. It may be that sometimes there's a functional center that covers more than one unit. It might be you have a unit that is involved in more than one functional center. It might be that you look and you see, it's not going to be obvious what that means, the functional center. Your managers may know, so you might want to ask the employer reps in the committee, or you can contact provincial office and we can provide you with some guidance. But the functional centers are listed on the left of the preliminary data. The next column on the right is the total hours worked. Okay, and again, it's broken down by unit, it's broken down by month. What are the total number of hours that are worked on that unit? And we've gone back 9 months for all of these purposes. The rest of the column, there's a number of other columns in addition to the hours worked. It breaks it down to say, of those hours worked, how much were worked at the overtime rate? Of those hours worked, how much were worked by casual employees? Those are two important things, but it also lists other things. It talks about on that unit during that month, how much sick leave was used? During that month, how much vacation was used? How much LOAs were taken? And those are going to come in handy in a little while. I'll explain that. Again, I want to reinforce the preliminary data wasn't able to pull the additional hours worked by part-time employees. Okay, that information just wasn't easily extracted from the employer's information. That's why you have to drill down and meet with the unit managers and the ward reps. Okay, the two most important columns, I think, for most locals in looking at the preliminary data is going to be the overtime and the casual. How much overtime is worked? How much casual hours are worked? Okay. For example, here is the preliminary data from a small rural facility. And if you look at it, one of the things to keep in mind is that in addition to having it broken down by month, at the bottom at the very bottom of each of the units or each of the programs, it has the total. So it has the total amount of hours worked, the total amount of overtime worked, both in hours and percentage, and the total number of casual hours worked, as well as the percentage. Okay. Also, at the very end of the preliminary data for each local that you'll receive, it's got the totals for Alberta Health Services. So province-wide, we didn't include the hours because that wasn't going to be particularly helpful. But what we did is include the percentage of overtime, casual, sick leave, vacation, LOA, etc. So you'll see province-wide for Alberta Health Services for that 9 months, the last 9 months, about 4% of the work was done by people working overtime. About 12% of the work was done by casual employees. Okay? So that's the 9 month total for Alberta Health Services province-wide. That might be useful as a guide if you're looking to see if something looks high or low. You might want to compare it to what the provincial average was. That's not the goal. The goal isn't to get to the provincial average, but it's just information that you might use. Another example that we put on is from a large urban facility, and when the locals look at this, the first thing they might see is medical unit B. They might want to look at that. And you'll see on that medical unit, you've got the total number of hours worked. You've got the total amount of work that was done at the overtime rate. It doesn't look huge, 1%. A couple of months there was 3%, but that's not huge for overtime. But if you look at the amount of work that's done by casual employees on this unit, you'll see that 29% over the last 9 months, 29% of the work was performed by casual employees. And it looks to be pretty consistent. 27%, 31%, the next month 20%. Well, it's fairly consistent that anywhere from 20 to 30% of the work is being performed by casual employees. That's going to tell the local that might be an area that's ripe for converting those into regular hours, maybe regular positions, maybe hours that people are adding to their FTE. But if 30% of the work is being done on a casual basis, I would think it would be fairly easy to look at converting those. Another example from the same local is, if you look on one of the following pages, it talks about the emergency department. And you'll look and see there, the amount of work done by casual employees is 11%. It's not tiny, but it's certainly a lot smaller than 30. So you might think, well, maybe that's not a priority. But if you dig a bit deeper, you'll see that each and every month there's more than 1,000 hours worked by casual employees. So the percentage may not be huge, but if you're talking 1,600 hours in a month worked by casual employees, that's 9 or 10 full-time positions. And so you look at the percentages. In the larger units, you also look at the total number of hours. And you might say, that's a priority as well. We're going to be able to convert some of those hours. Some of the other things you're going to find is things that maybe are a bit anomalous. Again, sticking with that same local, we'll look and we see some odd things going on in the minor surgical clinic. We look and we see, well, 1 month, 50% of the work is done by casual employees. And if you're only looking at a single month, you might say, wow, we could easily convert a lot of hours into regular. But if you look at the following month, instead of 50% of the work being done by casual, it's only 5% of the work being done by casual employees. If you look over a few columns, it becomes understandable, because on the 1 month, there was a lot of vacation that was approved, and a lot of people were off on vacation. As a result, a lot of casual employees. The next month, nobody was on vacation, so there wasn't as much work being done by casuals. So may not be as easy to convert the hours there, even though over the course of the 9 months it looks like 19%. Because of the way it was distributed, it might not be possible to convert, or if you are going to convert it, you might have to convert it by looking at something like a seasonal employee. Okay? So the preliminary data is just going to be used to prioritize, to look at it, take a look, eyeball it, and say this is a priority. We have to meet with that local or that unit, and then you sit down with the unit manager and the ward rep and ask them to go through the information. In addition to, we've got the information on the casuals, we've got the information on the overtime. Let's look and see how many, in addition to that, how many additional hours were there worked by part-time employees. And once that information is received, the local committee can look at how can those hours be converted, or can those hours be converted into regular positions. So it's a lengthy process. That's why we're encouraging the locals to prioritize. Don't try and do a large facility all at once. Look and see where the priorities are to convert. And it may well take a year, possibly more than a year or two to complete this process. But by the time it's completed, we think it's going to be beneficial for everyone. We think it's going to hopefully lead to improved quality and continuity of care. So that's better for the patients, it's better for the staff, it's better for the employer. Hopefully lead to increased job satisfaction, increased predictability in hours. I mean, our members have regularly said they don't want to be constantly called and asked to work overtime or asked to pick up additional shifts. Managers have far better things to do than spend their time on the phone, phoning hundreds of people asking them to come in and work shifts. Hopefully it'll reduce unplanned schedule changes, balance workload, minimize overtime, which is in everyone's interest. So that's a bit of an introduction to the process. Again, if any of the local committees have any concerns, you can contact the Provincial Steering Committee, or you can contact the UNA Provincial Office. We'd be more than happy to help you. Thank you.